Cancer treatments change often. Because of that, it's important our conversations with providers continue to evolve as well. Joining me to discuss what patients should consider while going through a cancer journey is medical oncologist Dr. Manoj Bhupathi. Thank you so much for being here. He is with the Sarah Cannon Research Institute at HCA Health One. Thank you so much.
Thank you so much for having me, Janelle. It's a great pleasure to be here.
So I just want to start off, we're talking about four crucial questions people facing cancer should be asking their doctor this year. What does that have to do with clinical trials?
Clinical trials have normally been thought of as being conducted at very large academic centers. They have not been thought about at local community-based cancer centers. Rocky Mountain Cancer Centers and Sarah Cannon Research have now been able to bring cutting-edge research to communities like Denver, and where patients can go to a local cancer center and get novel therapies for treatment of advanced cancer and get very, very good results.
That's amazing. And how does AI play a part in all of this?
We've seen the evolution of AI quite drastically across all fields. AI in healthcare is also very important. AI is not necessarily replacing your doctors, but it's giving your doctors the ability to utilize information from genomic testing or imaging or even patient history to make a more individualized plan for figuring out what treatment would be the best way of approach.
And what newer treatments are we seeing these days?
Yeah, there's a lot of new therapies that have been coming up, but the most recently antibody drug conjugates are probably the biggest thing. How I describe them as more of like a designer chemotherapy. They're more targeting the cancer cells and not necessarily the healthier cells, so that the toxicities become much lower and the tolerance becomes better, and the efficacy is also being seen much better.
And finally, what do you ask if other therapies stop working?
So there does come time when cancer therapies don't always work. In the event that cancer therapies stop working, there are a lot of novel therapies that are still in development. So immunotherapy combinations, targeted therapies, as well as antibody drug conjugates. Even if one therapy stops working, there's always another therapy that's there. I think the key message, though, is just because one therapy is not working, it doesn't mean that there's loss of hope. There's always more options that are available.
Dr. Bhupathi, before we wrap up, is there anything that people at home should know when it comes to making sure that they're monitoring their bodies?
I think routine exams, follow up with their primary care is really the most important thing.
Amazing. Thank you so very much for the time.
Thank you.